Please welcome the Atlantic's Senior Vice President of Partnerships, Molly Cox.
Good afternoon. Thank you for joining us. I'm Molly Cox. I'm our SVP of Partnerships here at the Atlantic. I am really pleased to welcome you to this important conversation about criminal justice reform. After decades of calls for reform, the criminal justice system is still plagued by rising crime rates, police violence, and an overall distrust in public safety. Here, we examine some of the major issues, such as crisis response, the probation and parole trap, and discuss practical policy solutions and action items to radically transform a system that is failing the people it is meant to serve. Before we begin, I want to thank the MacArthur Foundation for their enduring support of the Atlantic Festival and for making today's program possible. And now, you know the drill. Please silence your cell phones, but don't put them away. Our hashtag, should you feel so moved, is TAF23. So now, let's begin this afternoon's conversation. Thank you.
For a conversation on rehumanizing police response and public safety, please welcome Karhlton F, Director of the Bureau of Justice Assistance at the U.S. Department of Justice, Peter Moskos, professor at John Jay College of Criminal Justice and former Baltimore City police officer, Maya Wiley, President and CEO of the Leadership Conference on Civil and Human Rights, with Ronald Brownstein, Senior Editor at The Atlantic.
Good afternoon, everybody. Thank you for joining us, and thanks for my panel for being here. We're here to talk about police response and public safety. Let me just start by kind of, laying out the landscape here. Maya, maybe you can start us off. What is the principal concern about the way police are responding to calls for help?
So principal concern is, what do we need police to respond to and for? Right? So if we want to be safe, the question is, what is the safe response? What is the expertise that is needed? Let me give you a very, very personal example. My daughter, during COVID, had a friend over who had a psychotic break. Obviously, no one plans for that. No one knows it's going to happen. And my daughter had to figure out what to do. So she called 911. And then she lied. Because when they call, at the call, they ask, well, is she violent? And my daughter's immediate response was to say no. And the reason was her fear that if she was honest about being worried that because of the psychotic break, this young woman was believing that she was in danger, right? That they would send a police officer rather than an ambulance, which is what would have happened, and that there was a risk that her friend would be shot and killed. And she had actual reasons, factual reasons, to be concerned about that, because the police, while getting trained in emergency response, there are emergency response teams, are not mental health experts, are not expert in responding to and de-escalating a situation in which someone is having a psychotic break. And we know from other models that what we want is everyone to be safe, right? That public safety means the situation is being addressed appropriately for the problem that is being confronted, and the people responding have the expertise and ability to respond.
What about the flip side? Did she worry, or do you worry that if the person actually is violent, that the EMT wouldn't be safe if that was all that came?
Well, that's the conversation that happens, right? And what we know is when the systems are developed appropriately with the appropriate relationship between a public health response and a response that requires additional training and expertise that police bring, it works really well. And that's the Eugene, Oregon example, where the relationship exists, works effectively, and only in 1% of those emergency responses where you have a clinical response, not a police response, but with the police's backup available and with a formal relationship to that emergency response, only 1% requires the police to get involved. That's better for the police and better for the public.
Let's come back to that, because I was going to ask you about if there are models that got it right. But Peter, what do you think about what Maya said to start?
If you can have co-response, if you have the money for it and the political will, if they staff the phones 24/7, which is not done in any city, I don't believe, I think it can't hurt. I would disagree with Maya a bit and say police are better at this than a lot of people think. I mean, New York City is something like 200,000 mental health calls going through 911 a year. You don't hear about 99,950 of them. They do have some training. They're not mental health experts, but they have training. And they do have experience. By and large, they handle as well. The main, as I said, it's great to have other people respond if you can, but if there is the risk of violence, those other units won't respond. So look, if they can take the cream of the crop, the easy 20% of the calls, great. But the problems and the violence is going to happen from those other 80% that cops are inevitably going to respond to regardless.
When you said no one staffs this 24/7, obviously they staff 911 24/7. What were you referring to when you said no one staffs this 24/7?
They just don't have 24-hour funding for the resources aren't there.
For the co-response, you mean?
For the co-response.
For the co-response. Karhlton, what is the issue as you see
I
it?
think I should probably sit here, and I'll sit in between the two of them. The Cahoots model in Oregon is an excellent model. The STAR model in Denver, that's another example of a co-responder model. And the triage is done by 911 centers, and they make the determination at the 911 center whether or not it should be a police response or whether or not it should be a civilian response. And these work very well. The challenge, as I think you just heard, is that they are not 24/7 for the most part. Even the STAR program, which has been around for a very long time, I think they are from like 6 in the morning until 10 or 11 o'clock in the evening. And it's also...
So everybody should just be okay between 11 and 6, basically. That's
and it's an enormous investment,
Yeah.
right? But I think it's an investment that cities need to make. They really do need to make. They will get better outcomes. You talk to the average police officer and ask them, do you feel equipped to respond to many of these calls? Now, we have come a long way. We've invested in crisis intervention for the past 3 decades or so. We've done a lot of work with policing, but they're still not the same as having a clinician respond.
I was going to ask you, so let me ask you now, and you alluded to it, and Karhlton did a little as well. Talk about a city or cities that actually do provide a model. In your view, are there places that have gotten this right in a way that could be replicated more widely elsewhere?
Well, I will go, there are other cities that are starting to replicate the Cahoots model, and part of that is because we have seen deaths at the hands of police officers for mental health crisis response. Not all, but here's the point. Whenever we say we see something that's working, but we shouldn't, and I'm not saying you're arguing this, but it sort of becomes that we shouldn't do it because we don't have the money to do it right. What's the answer to that? Put in the money and do it right. Because the reality, and I say this as someone who, and appreciate both points, right? Because they're both legitimate points. But all it's saying to us is we're seeing something working, and more jurisdictions are also picking up on the model, trying to implement it. Some are implementing it differently. Everyone's experimenting with it. But at the end of the day, what we're really saying is we could do this differently if we decide it's worthy of it. And if we want police and community relations, because I just want to say this, my daughter didn't trust the police response for some really very real and very practical reasons.
So talk to a little bit more, though, about what does the alternative model look like? If you pick a city, Denver, Eugene, what do they do? How do they take it from beginning to end? The call to the
one is
doorstep.
the call comes in and gets directed to a mental health mental health crisis responders. Like in the Oregon case, in the Cahoots model, it's a clinical program that exists, and they have a formal system for routing the calls. There's a formal relationship with the police department in the sense of having the police nearby, and it is the clinicians that decide whether or not they're needed, right? So there's a mental health evaluation. That was my point about the 1%, where they say, we do need you. And then they are the ones who make the determination whether the police intervention is necessary. But what that means is you have that crisis responder who is the mental health expert, who understands the de-escalation from, say, in my daughter's friend's case, a psychotic break. By the way, that ended really well without a gun. And then the other part of it is they have a place to take the person, because that is the other problem with the system, that it's not a problem of the police department's creation, is where do you go? So either you go to an emergency hospital bed and have some clinical follow-up, or you don't, right? Because in New York City, for example, we have a huge percentage of the Rikers Island population that are getting sent there because they're mentally ill. And very, very, very small percentage are violent crimes.
But to be clear, the model that you're describing is not a co-response. It's kind of a sequential, right? You're saying it's only mental health professionals originally, and police if needed, not both of them riding together in the same car.
Well, I think what I'm saying is yes, the Cahoots model is not a formal co-response, so that they're both showing up to the scene side by side. Right? And I think, and what we're saying as a civil rights community is that is a working model, particularly where you have the relationship with the police department so that there's easy proximity. And I want to say this idea goes beyond mental health crisis response. I mean, violence interruption is another example of this, which is community-based violence mediation that can prevent the need for a police response before someone is harmed. So I do want to say that it's not only a mental health crisis intervention in the formal sense, and the point is to say that there's a role for everyone. There are probably different ways to organize it, but we're very much in favor with the Cahoots model.
Peter, do you have a sense of kind of, to the extent this approach broadly is being used by police departments, is that, I'm going to call it sequential, sending out mental health professionals alone, or more places trying to pair police with mental health professionals?
If I could answer the question I want in this case rather than the one you just asked, I think part of the problem is the focus on response.
Okay.
I believe these responses can be good. If we want to fund them more, great. I also believe that the police response isn't as bad as people think. But once you reach that point of needing a response, it's too late.
Right.
There is a greater failure in our mental health system. And to some way, this is just sort of rearranging deck chairs, which, hey, we can have a better arrangement. I'm all for that. But this isn't solving the problem, and is not specifically solving the problem of violence, the rare cases of violence when it goes with mental health problems.
So therefore, what the focus? I mean,
we can focus on this as maybe a better treatment for mental health issues, but I don't think it's going to reduce the level of violence used by police, because police are still going to be handling the tough cases. It's too late when someone's having that psychotic break. We need a better system.
We do need a better
And that's how you know it's working, is when the number of calls goes down, less so than who responds to it.
Karhlton, what do you think? I mean, I'm interested. I mean, obviously it's an integrated system. There are problems at every point, but police have most control over what police do, rather than what the county or the state is allocating for mental health. I mean, that's the part that they have control over. And I'm just interested in your experience, both at the state level and at the national level. What is the point of leverage to change the way police think about responding to these kinds of calls? Is it the training? Is it the intake of the calls? Is it the co-pairing? I mean, where do you get a shift in actual behavior?
I'll say yes.
Yeah, all.
Yes to all of those. But it's also, the reality, it's also all of us. We live in a country where we get kind of what we deserve in many cases. And if we're okay with the type of response we're getting right now, then we will continue to justify the current level of response. And, I was just in a community yesterday. I was just in Louisville, Kentucky, who has been through, that department's been through a lot. and that community has been through a lot. And those folks in that community have demanded something different. They have brand new leadership there. You talked about de-escalation. They're implementing. I think we need to have a conversation about de-escalation as part of this conversation. They're implementing one of the only evaluated de-escalation models that has been proven to reduce violence, to reduce injuries to the public, to reduce injuries to officers, to reduce uses of force. And they're doing that. But that was after a terrible, terrible situation. And we need to be more engaged. Because part of the reason why this has gone on for so long is because we've been silent and just silently okay with it. And this level of response, I mean, first of all, I was in LA. LA has built up an enormous response, right? Mental health response. And when I saw it, I was both impressed and saddened, because why is it that we expect police to be the medical caretakers of people going through a mental health crisis? And that is part of the problem.
Can I show there? I mean, my colleague David Graham did a piece a couple years ago in Durham, North Carolina, which was struggling with this issue, and they sponsored focus groups. They organized focus groups of the police officers, and in one focus group, one of the officers said, "One can't expect every person to be the best mental health crisis responder and the person kicking down the door and several other police responsibilities all at the same time." Are police comfortable being put in this role?
Some are, some aren't.
Yeah, and go ahead.
You know, I'm sure you have thoughts on that,
Right.
but, you know, some are very comfortable.
Some aren't. That's
Yeah.
what I thought.
And some aren't. Some, you know, I think it probably depends upon when you were recruited, why you decided to get into policing, but it is asking someone to be a lot of different things. And
We're not all Shohei Ohtani, basically. I mean, it's asking people to do things that one human being does not usually have the skills to do all of those things. That is a good reference, actually. Peter, what do you think? I mean, would most, I mean, I can't, maybe that's the wrong way to phrase it. To what extent would you think individual officers on the line would feel a relief having support from mental health professionals as they deal with these kind of questions?
Well, they love it. They love not to be called at all.
That's
I think some deal, as you said, some are happier dealing with this than others. But I think police are cynical and know these other groups are not effective enough, and police are still going to be called, so they accept it as part of the job. It's important. Look, training is important. CIT training in particular is shown to be effective for cops. I'm not a mental health expert, so I don't know that training.
Right.
I assume it's valuable, but there's no magic de-escalation pixie dust just that social workers show up. They say, send a social worker. Well, social workers get killed too. So we have to be realistic. It's not just a matter of replacing one with the other and everything's going to be solved. I mean, I guess it's a way of saying this is a heavy lift regardless of who does it. And it can be better.
I'm wondering, do we know, and it's a question for Maya, but also maybe for Karhlton, do we know to the extent, if we're not talking about replacement, if we're talking about enhancing the ability of police themselves to respond to what extent is this now more a part of training? Are there many communities that are lifting this up?
So I think we have to unpack, because there are several points to your question. One is vision. Like, what do we want to see for our society? What does it look like to have a society that we deserve? And by the way, when we say deserve, who? Because a lot of the folks who are getting killed or beat up or not getting prevention services, because I completely agree, ideally we'd be orienting our resources around preventing the need for the call in the first place. And that if we have that as an ideal as a society, we're having a different conversation. Because we're having a conversation about how we prioritize our dollars to our vision. And that's not what we're doing right now. We're prioritizing our dollars to our fear. And that's the shift we have to make. So I think people have different views about what the end game is, whether it's a both and or abolition. My point is, the only thing I hear from community, and I am speaking specifically for communities of color, that are both over-policed, under-resourced in all the things we would consider prevention, right? And then getting the brunt of what that means. And that is my point about what decisions people make, including whether they make a call. I can tell you there are a lot of people who don't make the call. All right, and we should own and understand that. So training, to your point, is a mechanism. It is one I support, we support, across the board. What are we training to? But training itself will not change what we're trying to change in the absence of the accountability for the outcome. And what I mean by that is, and this is true in, I'll just take implicit bias, and this is implicit bias in any institution, including policing, but not only policing. Unless you're orienting to, is the training producing the outcome, and is there accountability for failing to use the training? Because I also chaired the New York City Civilian Complaint Review Board. I can tell you we saw all kinds of cases with officers who were not following the training that they received, and sometimes not having any consequences for not following it. If you don't have the orientation of the consequences for being accountable to the training, it doesn't necessarily matter that you have the training.
Let me, that's an important point. Let me follow. Accountability was one of the goals in the president's executive order on policing a little over a year ago. Come back to you on that. But Karhlton, the executive order did talk about precisely this. It said that HHS and Justice would develop guidance for first responders and encouraging the kind of the co-response model. I believe that guidance has now been issued. To what extent do you have a sense of the extent to which it is influencing police departments around the country, and what are your tools to try to nudge them in that direction, since you distribute a fair amount of money?
I'm going to give you the worst possible answer, which is it depends. Right? It depends. It depends on the community. It depends on the leader. It depends on the leadership there. You know, there are certainly organizations that we work very closely with and are very responsive, but there's 18,000 policing agencies in this country. And I think the thing that we really need to focus on are the types of mechanisms that we have to guide and provide information to people who want to have this information. And the challenge is...
It's a coalition of the willing.
Yes, it is.
It is?
It is.
Yeah.
So, I mean, we built something called the National Law Enforcement Knowledge Lab, and it is basically a clearinghouse around constitutional policing. But it, again, is a tool for the willing. Now, we've got to do a better job of driving people to it. You know, I was in the UK. It's much easier there. Mm-hmm. They have a smaller number of agencies. All their agencies are large. But they have the Home Office. They have the UK College of Police. They have a national problem-solving model. There's uniformity, uniformity, uniformity. And we've got to figure out a way how, respecting the fact that we have different jurisdictions with different governments, how do we get to the point where we have some level of uniformity?
Before I bring Maya back, Peter, what do you think? The executive order from the president, whatever we think about it, it's an effort to kind of, put some markers down and say this is where we want policing to go. Is that an appropriate role, you think, for the president and the federal government? Should they be trying to influence how the 18,000?
Yes.
Yes, because we do need some standards and accountability. And a lot of our focus is on the big departments because they're bigger, because that's where newspapers are. By and large, those were.
Okay, sorry.
No, don't be sorry.
By and large, those big departments do better than the small departments. And no one looks at the small departments. So, there is some best practices. Even best is maybe a bit too superlative, but better practices in big cities that we should be trying to push out into other departments. And you do need some, the centralization could come from the federal government with carrots, but it could absolutely be done at the state level.
Maya, when the president signed that executive order, the very first item on the long list of initiatives in the White House fact sheet was the national database of police misconduct. That was first among equals. Federal law enforcement had to participate in it. Local agencies were encouraged to do so. Now we're nearly a year and a half later. Where do you see things standing on establishing more or even nudging local local police departments toward more accountability?
Well, and you know, I think Peter makes a really important point about the small departments, because it's true. Most of them are very small. The nudging, I don't think we're seeing enough grant dollars. This is one of the things we've been pushing for, so that there is more resourcing coming from the federal government for the prevention and for the support for some of the changes needed, including the information necessary to identify where's excessive force happening, how, so we better understand it and better figure out how to intervene. And that is, so I think some of it is, there's only so much you can do by executive order, because again, what the president doesn't control local police departments, the president controls federal law enforcement. But we know that the other thing the federal government has the ability to do is create the incentive of the grant-making programs that attach to the importance of resources, particularly for those small departments. And look, you want to talk about white supremacist police departments, go to the small ones. Go to small ones in the South. I mean, we're hearing it from communities that say, look, no joke, they're white supremacists. What do you do about that? That's very hard in a small department, and the federal government actually doesn't have a lot of control about that, except if we're actually creating a national system that tracks, where the federal government is identifying those actors, and there's an ability to track the accreditation that sort of comes with someone getting fired from one department and showing up in another.
To what extent is that system coming into place? I mean, that's what they want. What, do you have a sense of where we stand on that?
So we're still evaluating, and we're in a lot of discussion about it. We really actually appreciate that it's in the executive order, and it's not easy. You know, and I just want to acknowledge that. A lot of these systems changes that we're talking about doesn't happen overnight, is very complicated. I think part of what we're seeing is you have to have the investments, the resources, particularly but not only in small departments, that enable them to do it and give them the incentive.
You're sort of near these resources.
Yeah,
and
tangentially.
Yeah, I think you were saying less stick than carrot, less denying dollars to people who don't do things than providing dollars that will enable them to do things.
With the accountability, though, that they have to show that they're doing those things.
Well, you know, the National Decertification Index is something that we are working on. And you know, the challenge is lots of states don't even have a decertification index. So you're talking about 18,000 agencies. How about trying to track 800,000 police officers when you can't go to a given state? I know in my home state of Ohio, it's an enormous challenge to be able to figure out. And we've seen the impact. You know, one of the cases that, you know, Tamir Rice meant a lot to me. And that was an officer who was at one agency. And if you've had a chance to read what his chief thought of him, ends up at another agency. And, you know, we talk about de-escalation, and then does something that you would never train a police officer to do, which I think is probably another discussion we need to have around use of force when the police actually create the exigent circumstances, right? And so you see the importance of it, but it's a challenge.
Yeah, we're almost before they're going to give us the hook for the next terrific panel. But Peter, your thought on that situation? How we're in the information age where you can Google the front of a house in Turkey, and put in an address, and you can see what it looks like. Why can't one police department know when someone has been let go for this kind of behavior somewhere else?
Bureaucratic inertia and political will, I think. I mean, it would seem like a list of decertified cops should be low-hanging fruit, and maybe it is, but it's still not easy, as you can say. But we don't even know how many people were murdered in America last year. The shift, I mean, we don't have basic crime stats in this country. The shift from the uniform crime reports to NIBRS, seems like inside baseball, but we don't have crime stats. If we don't have basic crime stats, how are we going to get it into nuances of police? I hate to be pessimistic about this, but let's start with crime stats, then go to policing. I mean, I don't know why this is so hard, and it's I'm sitting on the sidelines.
My final word for you: why is it so hard? Is it will or is it capacity?
Both.
Both.
It's both. And I just want to say, New York City Police Department, largest in the country by a factor of 3. I mean, it's massive. It's 50,000 employees, 36,000 of them in uniform. It's a city unto itself as an agency. They have the most antiquated human resource system you can ever imagine, and that's as the largest. So I was really struck by it when I was in city government, that there was such a lack of capacity. But there's also a culture that's kind of this militarized, don't tell us what to do, we do it our way, and you don't have a right to hold us accountable even as public servants. And that is that's not every person in the police department, but it is a culture that has taken root, that suggests that nobody can tell us how to do us.
That was a lot of candle power on that panel. Will you join me in thanking Karhlton, Peter, Maya?
For a session produced by our underwriter, the MacArthur Foundation, on how to invest in safety and well-being, please welcome Aswad Thomas, Vice President of the Alliance for Safety and Justice, with Bria Gillum, Senior Program Officer, Criminal Justice at the MacArthur Foundation.
All right, well, first of all, I'd like to just give a big appreciation and thank you to the Atlantic team for curating today's criminal justice session here at the festival. The MacArthur Foundation's main initiative is called the Safety and Justice Challenge, and we're investing in local communities to develop and implement programs and policies that address public safety within their communities, and also addressing the racial and ethnic disparities that exist. And we're doing that by building partnerships with organizations like Aswad, as well as with local community partners, associations, and with our criminal justice stakeholders to really make meaningful change across our local communities. So I'm excited today to be joined by Aswad and hear more about his journey and his own personal experiences of the criminal justice system. So I wanted to start today's conversation with our matching blue on blue. Just to hear a little bit more about, one, what is your journey? What was your journey into the criminal justice system, both as a victim and now as an advocate for reform?
Oh, it's a loaded question. Really it's taken me a long journey to get to this point in my life and this point in my career. Nearly 13 years ago, just after I became the first male in my family to ever graduate from college, I was shot twice in my back during an attempted armed robbery by two teenagers. And that incident ended my basketball career and nearly my life as well. And I remember being released from the hospital back into the same community where I was shot, not connected to any mental health services, any support at all. And as I was going through that experience, I often wondered, am I the only person that went through that? But I wasn't. My father was shot in the 80s. My brother was shot in the 90s. I have two cousins that's been shot in the 2000s. And all of us had many interactions with the justice system, but none that actually led to any help or services at all. So I started to think about what was happening in my experience of recovering, but also my family's experience. But the thing that changed my life was during my last doctor's appointment, I learned that the young man who shot me was also a victim of gun violence 4 years prior. And just like me, he was released back into that same neighborhood with no support. And then the second teenager that was involved in my shooting was later arrested, and I went on to forgive that young man for that incident and also help to advocate for him to get a lesser sentence. So those are the experiences of my family experience, my experience, but also the two teenagers that were involved in my shooting that led me to this work of organizing crime survivors across the country.
What was that process like sort of personally? You were going through your own recovery and healing and now sort of reaching back to others that have also had similar experiences. Did that re-traumatize you in any way? How are you sort of navigating still, I'm imagining still healing from what happened to you, even though it was a while ago, and into this work that you're doing now?
My story is, it might sound unique, but it's not unique at all. In this country, 3 million people are crime victims every year, but only 9% of people actually get access to victim services. Over 96% of victims do not access the victim compensation program, which is supposed to help victims like myself. So as I'm traveling the country, listening to so many crime victims, as those stories are starting to sound the same, but people are being hurt by crime and violence every day, but not getting any support and services. And that's what kind of led me to really starting to organize survivors, but also training them to be advocates at the local level, but also bringing them to the state capitals to advocate for more criminal justice and public safety policies, but most importantly, help them to build an infrastructure of victim services in communities.
I want to talk a little bit about, our country is deeply divided. That's been a big theme of this whole festival. And I'm curious, sort of, what is your approach to coalition building? How do you strengthen both the relationships that you have with your allies, but I'm also curious, how do you build relationships with some of your adversaries, for some who might not understand what it's like to work with victims or really just haven't even thought about it as an important part of justice reform?
When you think about the criminal justice system, the voices of crime victims like me have never been at the center of criminal justice making policies. And one thing that we are trying to do is elevate this new victims' rights movement. They are calling for more safety solutions, to help stop the cycle of violence. You think about crime victims, what we want the most is what happened to us to never happen again. We also want to make sure that we have services and resources in our communities to help address the trauma and the unaddressed traumas that continue to plague community. So we do that by helping to build our trauma recovery center model, which is a one-stop shop center that provides survivors with all the victim services that you need without all of the red tape. We started with one trauma recovery center. Now we have 52 of these centers across the country. It's really about building that infrastructure of victim services as well. And our work around coalition building is really quite simple. What we do is we build community. We build community with survivors, providing peer-to-peer support. We build community with law enforcement, with advocates, with legislators, and we build that community so that we can start having conversations around our public safety policies. And what often happens when you build community and build these coalitions, we tend to address some of the root causes of violence and really work to advocate for more public safety solutions. And so our organization, the past 10 years, we've passed about 91 criminal justice and public safety reforms across the country. We've changed victim compensation programs in about 10 states. We're helping to provide more protections for victims to be safe from employment protections and housing protections, but also across this country, crime victims are now organizing to change criminal justice policies. We passed reforms to help reduce incarceration, help to incentivize more rehabilitation for folks who have caused harm, but also working on reforms to remove the barriers for people coming out of the justice system. They are coming back into our communities. We also passed laws so they didn't access housing, jobs, education, things that help promote stability, but also those are the things that help keep communities safe as well.
I think just kind of building on that, you've talked a lot about sort of your approach to community safety and the resources that are being provided. I'm wondering too, is there a more comprehensive approach that is inclusive of victims that is part of your definition of safety? Sort of how do you think about what does it mean to feel safe in your community?
I think we all want to be safe, right? So just, everyone here, just close your eyes with me and just think about where you feel most safe. Is it a garden? Is it at church? Is it with family? Think about where you feel most safe. Majority of us in this room, I don't think we said more police. We feel more safe with more prisons. We felt more safe in community with each other. So those are the things that we have to start investing in. More trauma recovery centers, more mental health programs, more solutions that help to stop the cycle of violence. That's how we actually get to true safety in this country.
I love that. Hopefully everyone opened their eyes by now. And I just want to sort of end on with this one last question. I want us to sort of feel that there is hope, that there is a lot of good work that's happening in the justice space. And so I want to ask you, Aswad, what piece of advice do you have for the audience for us to take away with?
We're all living in hard times, right? A lot of uncertainty, violence is happening in our communities, a lot of hopelessness. The one thing that I would like to, you all to take away is, just check on someone. Check on your family member, your loved ones. Check on our youth in our communities. Check on, your neighbor. Just spend time just checking in on each other and being there for people. So that's the one thing that I want you all to take away, is just check on someone.
Well, thank you so much. Please join me and thank you, Squad, for today's conversation.
And now to discuss probation and parole reform, solutions for success, please welcome Yasmin Cader, Deputy Legal Director at ACLU, Robert Rooks, CEO of Reform Alliance, Sam Schaeffer, CEO and Executive Director at the Center for Employment Opportunities, with Adam Harris, staff writer at The Atlantic.
Good afternoon, everyone. Thank you so much for joining us today. Yasmin, I want to start with you to sort of frame the conversation for us a bit. So when we think about the ways that probation and parole are sort of punishment rather than a sort of rehabilitation, what do we mean when we say that, right? Like, how is the system as it's currently set up effectively setting people up to fail?
So we have 4 million people on some form of probation, parole, or supervised release. And what we're finding, because of the way that it is designed, it really is like a tripwire to mass incarceration. It is set up not to be rehabilitative, but to be punitive. It is part of the carceral state, and it is so different from what I think originally, centuries back, was intended to be in terms of a rehabilitative measure to get people back on their feet. Instead, the practicality is that what we have are people that have sets of conditions that their release is contingent upon that are often just impossible to meet. Conditions such as employment, while you also have a felony conviction often, you have to secure employment so you can pay your fines and fees. Then you also have to make sure that you're meeting with your probation officer while you're taking care of your children or other family members, and at the same time attending any type of mandated drug counseling, any type of mandated job training, all at the same time with onerous conditions. And if you fail to achieve one of them, often which are contradictory, imagine paying fines and fees, having employment, but having to go across town to see your probation officer, and you have to make a choice of which term am I going to violate, and then you're looking at being catapulted right back into prison. It doesn't rehabilitate, it doesn't stop recidivism, and instead it really is mass supervision, which is fueling mass incarceration.
And so, Robert, as Yasmin mentioned, right, this is sort of getting away from the original intent of parole and probation. So this is actually a little bit more of a philosophical question, right? So what are we actually trying to achieve if it's not rehabilitation, if it's not decreasing recidivism, right? What are we actually trying to achieve with parole and probation?
Well, there's a couple of things. One, John Augustus was the first person that was attributed to being our first probation officer. He saw an individual who was facing incarceration for public intoxication. He intervened. He told the judge that he wanted to work with the person, and he did. And the person returned to the judge clear-eyed, and the person was released. The judge basically went back to John and said, hey, I need more of your time. I need you to work with more people. And that's the founding of probation in this country. Where we are now is a totally different system, a system that's completely broken. Yasmin was 100% on point in terms of articulating how the system kind of works or doesn't work. I also want to add that if you think about the sheer numbers of people that are incarcerated, nearly 1 in 2 people in prison and jail today was on probation and parole yesterday. Right? So there's no better definition of a broken system than what we have today. And so moving to a system that is helping people get connected to programs like SAMS, right, where people can work or people can be part of housing programs, or we can get people connected to those things that help them address the root causes of why they were incarcerated in the first place, mental health and addiction services. That's what probation and parole needs to be doing instead of managing failure.
And that was a perfect segue into Sam, right? When you think about some of the programs, some of the things that are required for people to actively, reintegrate into society, how are you considering and thinking about the immediate necessities of those who have been recently incarcerated?
Yeah, and some of these statistics are well known, right? Over 600,000 people a year return home from state incarceration, often with some mix of excitement, trepidation, anxiety, right? They are eager to put their lives back on track. They're also going to come with an average of 20 conditions. These are what Yasmin referred to earlier. These conditions, which you rightly said, are often contradictory. The one on employment, almost in every state reads, the obligation of the person on parole is to seek, obtain, and maintain employment, right? So we've talked a little bit about how, if you have a curfew, that can work against your ability to work that overtime shift, right, that your boss wants you to have. If you have a travel restriction, it might prevent you from taking that job that's a little bit better, pays more for your family. But that very language is so vague too, right? What are the definitions of seeking, obtaining, and maintaining employment, especially in a justice system, which we know is disproportionately represented by men of color, who are going to face particular challenges that are well documented in the labor market. Stigmas, racism, right? So it's not just so simple. Everyone wants that job. Everyone wants and needs that immediate income, but just telling someone they have to do it, it's actually incredibly problematic.
Yeah. And thinking about, sticking with you for a moment, right? So you have a program, right, that gives people money as they're reintegrating, right? You think about the sort of gate money.
Yeah.
Can you talk about that program, the success of it, whether it's scalable, right? Just thinking a little bit about that program.
Yes, and so just sort of as background, so the program that I have the privilege of leading, the Center for Employment Opportunities, guarantees everyone who comes through our program, 8,000 people a year across 12 states, immediate employment, right? So within 2 days of coming to us, right, they're immediately being given a work opportunity on a paid crew where they're paid daily, right, to really meet that need, right, of income. During COVID, when our ability to field work crews, when our ability to get benefits for people, right, who had recently been incarcerated was under severe threat, we raised $34 million from philanthropy and distributed in increments of $3,000. And the assumption at the time was this is a substitute, right, for a workforce program. We will give people money because we cannot give them a workforce program. And what we found, so many important lessons here, but really the fundamental one was that when we give people resources, real meaningful resources, we build trust, right? We build connection, and we actually open up the bandwidth to fully participate in an employment program, in a housing program, in a mental health program. So this idea that we just need to give people services or just give them cash, they actually work incredibly well together.
Yeah. Yasmin, I want to go back to you because you talked a little bit about some of the technical violations that send people back, right? And if you receive the cash assistance, $2,500, you have something for your housing, right? That reduces some of that ability. But can you talk a little bit more about those technical violations and how they are structured in such tedious ways, oftentimes, to effectively set people?
Tedious, onerous, lots of descriptions. The thing about what technical violations are is they're not an allegation that you committed a new crime. So it has nothing to do with recidivation. Instead, it has to do with you missed your appointment. You missed a series of appointments. You didn't call in to say that you changed employment, or maybe you called outside of the business hours. You failed to attend your drug treatment program, where maybe because you were seeking, obtaining, or maintaining employment. It is ticky-tacky, and if anybody put a close lens, frankly, on any of us, you're going to find a place where you make a mistake, where you slip up, where you don't meet your specific schedule. And so these technical violations drive not just people back to prison, but think about the disruption. You're trying to get that foothold that we've described, and now you have a technical violation. Now you're taken out of all of the stability markers that you were trying to achieve, catapulted back, but there's more. Because when a person is violated, there often is not the typical constitutional due process protections that a person that we would assume. There's an allegation that you violated. You want to be able to go and say, well, let me tell you what happened, or in fact, that's a mistake. Often people are catapulted for weeks and months, even years before ever even having a hearing. And of course, as you know, I'm a litigator. I love the Constitution. We're combating that, but that happens all the time. And then don't have a disability. Don't have a disability. Imagine you can't read, or you're hard of hearing, or you have an intellectual disability, and you have these just complex, onerous, technical requirements, and you violate those. That's just not the values of our society, and it is really going contradictory to that. I just though want to say this about probation officers and the structure that they're in. So many, and I was a public defender for 23 years. I saw this on the ground. I'm looking at this through the lens and the eyes of my clients, but also through the lens and the eyes of so many people who want to do something different. Yeah. They want to do what Sam's do. They want to provide housing. They want to provide jobs. And they are left with the only tool, which is violation. That's the only tool given to them in their toolbox, reasonably.
Yeah. And Robert, can you talk a little bit about that sort of the ways that probation is sort of underfunded, right? It's sort of systemically underfunded, so they're not able to devote the time that they might to someone who may have a substance abuse problem that needs that treatment, but they weren't able to spot that before because they had so much else on their work.
Yeah, let me point to a couple of examples where we've seen movement in the right direction when it comes to probation and how it's managed. The state of Massachusetts, for example, still has issues with racial disparities, significant. However, when it came to investing in reentry strategies and help for people, they utilized and tapped into universal health care. And universal health care dollars has been leveraged to get people help. And so they're diverting people into programs as opposed to sending them into prison. We've seen over the last 10 years a 50% reduction in technical violations in the state of Massachusetts because of accessing universal health care. We've also seen significant changes in the state of California. Most recently, California has gone through a number of significant reforms in its area of probation, which has freed up resources at the county level. And we're seeing innovative strategies emerge at the county level in California. For example, El Dorado County noticed that many of the people on probation were homeless, and they had to figure out what to do. So El Dorado County bought a couple of houses, moved people in, gave them credit for helping to manage those houses, and got them off of probation. So they met the needs specifically of people on probation, but it took reform in order to free up those dollars, similar to Alameda County, where the Alameda County probation is investing in substance abuse treatment for people on probation. So you need to be able to make the hard work happen when it comes to structurally changing how probation departments are currently doing things to free up their resources to invest in programs like SAM.
Absolutely, and actually I want to stick with you for one more second because I've thought a lot about if you think about the technical violations, you think about the way that people avoid those technical violations. How can that, right? Trying to avoid, being sent back into the system, right? How can you just talk a little bit about the dangers and pitfalls of that as well?
Oh, absolutely. I mean, that question really hits home. I have a nephew in Philadelphia, not too far from here. He was on probation, but worked in Delaware. And the probation officer noticed that he was leaving the state, leaving the county, and warned him several times that he needed to find another job. And so he quit the job. He had to become a Uber driver that could only allow him to transport people within Philadelphia city line. And so that shows right there. That impacted. He has 3 kids, so that impacted his family, his ability to take care of them. And so those types of decisions are happening all the time, where people either decide to change what they're doing to make money and to live, or to break the rules of their probation, which puts them in jeopardy of being sent back in. Every day, you have tens of thousands of people making those decisions. It's just not right. The system shouldn't be built for that. The system should be built around finding out what people need and getting them that thing that they need to be successful and stable.
Oh, do you have something to add on that one? Okay. Well, actually, I was going to come to you next, Sam. Just thinking, Robert talked about the sort of reform at different state levels, thinking about Massachusetts, thinking about other states. If you go back a couple of years to 2020, right, when there was a lot of energy around criminal justice reform broadly, it seems that with a couple of news stories, that national interest it sort of shifts, right? Kind of with it sort of ebbs and flows. Can you talk about this moment, how it may differ from a couple of years ago, and what that means for the possibility of reform?
Yeah, I mean, it's so interesting you brought up John Augustus, right? And the shoemaker in Boston, right, who said, bring me the people so I can be this off-ramp to incarceration. And the founding of parole, which was meant to be that early release exit valve, and how far we've come from that moment. And there's been advocates who've been trying to make the system better. There's been advocates trying to entirely rebuild the system. And I think the story with parole and probation, and it's in large part, doing credit to ACLU and reform, is like putting this on the map. I think like people still fundamentally don't understand how unfair the system. So there are these broader criminal justice trends. But the more opportunities we have to talk to our neighbors, to people in our community who aren't aware, many certainly are, who are directly impacted, people whose families are directly impacted, but just how unfair the system is, how this Warren's maze of violations can trip people up really outside the judicial side is critical. I would add, though, I think politically, and where we really have to take advantage of this moment of reading more people into what's happening, is how do we fundamentally redefine what success looks like for parole and probation departments, right? Like, imagine a world where a department is incentivized for the number of people who enroll in complete and post-secondary education. Imagine a world where, a bureau chief or even a director of corrections, right, is given an award because they've actually gotten more people off of probation, right? Right now, the incentive structure is entirely based towards avoiding all possible potential for the most minuscule error, right? And so any slip up that could maybe result in recidivism, right, is going to land someone back in. And I think until we, give the political support, until we build the narrative that can, really tap into that political support to say, no, this system is built to do something else, I think it's going to be very hard to have that broader change conversation.
Yeah.
I also think when we think about the reform, having it in the carceral state is going to be a problem. And shifting the emphasis in terms of strengthening our communities in the first place. And that is what we see in some of the examples. I mean, New York had some amazing leadership that was doing just what you were talking about, which was saying to the probation officers themselves, listen, if this person is reoffending after the first 3 months of release, I'm holding you accountable. That means you're not engaging, you're not helping, you're not redirecting them to the resources that they need. But more importantly, they were shifting the resources to strengthen the actual communities where people come from, for everyone, not just for those who are on release, but for everyone. Because if we have strong communities, we're going to have strong, well-resourced bastions of opportunity for people to come back to, and then much less recidivism in the first place. So I do think that we need to think about how we change these departments. I also think we need to think about how we shift resources out of the carceral state and into structures of opportunity, which can be administered by government, but just not with this idea that if somehow something goes wrong, we are subject to automatic shift back because of a perceived or real rise in crime.
Oftentimes we're sort of hamstrung by a limited idea of political possibility, right? If you think, if the federal government can't do it, then we're going to be, we're just going to be in a bad place. But there are things that state level governments can do. There are things that local governments can also do. Can you talk about, Robert, I'll go to you first. Can you talk about the political possibility for what, we've discussed some of it, but what can be done practically, in the short term to reduce that 4 million, person burden that we have?
Yeah, I'm a huge champion of county engagement on this issue. When you pass a law at the state level, you have to work on the implementation of that law. Right? So you're turning the law back over to the very systems that may have fought you in getting that law passed. But if you can engage at the county level, specifically with probation heads, so probation departments, and get practices to change. For example, who is involved in a revocation decision, right? In some states, it's just the probation officer, it's just the parole officer. In other states, it's actually a group of people that decide where the person should go or what the person may need as an alternative to incarceration. So you can change county practices, which will have direct, immediate impact in helping people get to stability, get to where they need to go in order to be successful. So my hope is that in the coming months and years, that our work shifts more to county work, and it allows us to speak more directly to your question, to Sam, regarding crime. Right? This is a moment to lean in, not to leave. And funders that are considering this work should invest in local county work to help us invest in the infrastructure that's being talked about here to get people where they need to go. And if we do that, we'll win the day on the narrative.
So it's less of just completely forgetting about what's happening at the federal level, but more of shifting the focus, the primary focus to the.
And the impact is immediate.
Yeah. Well, still kind of acknowledging that federal level is still important. What are some of the things that can be done? Now, go to you with this one. What are some of the things that can be done at the federal level, given the sort of political environment that we are in at the moment?
Yeah, I think there are tremendous possibilities at the federal level with existing federal funding streams. There are these bright spots: Alameda County, Massachusetts, New York overall, California. But there's still the person I was speaking to last week who had to travel from a rural county in California 2 counties over because there was no services there, and his parole officer was saying you have to enroll in a drug treatment program regardless of the fact that he never used drugs, right? So we have this need, but that was the only service available. They wanted him engaged in something. And so we just simply have not built a reentry infrastructure in this country, full stop, right? So the federal government today has 2 programs, one through the Department of Labor, there's also through DOJ, the Federal Second Chance Act. They give about $400 million annually, mostly to demonstration projects, right? Which is great. Very few of those demonstration projects over the last 20 years have actually sustained themselves, right, into full-fledged programs. And so the idea that, yes, we want potentially probation officers to be service brokers, that actually can't really happen until we make these big investments. Where that can happen is certainly, through the hardest part of lobbying, right, which is getting more money into the existing programs. But actually, I think what's as exciting and maybe even a better potential in this moment is how do we tap into TANF, what we, the system that formerly was what we would call welfare? How do we tap into our SNAP beneficiary programs? How do we take existing resources and open them up to justice-impacted people? How do we take the trillions of dollars that are going to build roads and bridges, that are going to build the nation's first electric vehicle charging stations, and say, let's take these infrastructure priorities and create pipelines directly from the carceral state into these opportunities? That's the appropriation of no new dollars has required that, but it's the leadership of governors, of mayors, right, to connect those dots and say, these are individuals who have been disadvantaged so significantly in the labor market. There is actually now a pathway, a time when we need workers to help fill those critical jobs.
And I'm going to open it up to the audience for a question in just a moment. But before I do, Yasmin, one of the things I've been hearing is that there are these sort of catch-all approaches, right? You talk about someone who you need to go into a drug rehabilitation program. Well, I've never taken drugs, right? How as a defender for so long, right? When you think about your clients, when you think about the what they were thrown into. Can you just talk a little bit about those catch-all programs and why they fail?
Well, because they are cookie cutter. They're not individualized. They're not looking at what is the specific need and issue here with this person. I used to walk out of the courtroom with a sheet, and often it was one of those transparency sheets you couldn't read very well, and there were boxes, and those boxes would be checked. We're going to do this, we're going to do this, we're going to do this, and this. Little place to maybe write in something, but it's boxes. People aren't boxes. We're all so more interesting than that. And so specifically tailoring what someone needs, as importantly, what they don't. What they don't. to be able to start their lives anew and afresh, and to bond with their community and with their family, and to recognize the potential and opportunity in themselves. So I think the boxes, let's get rid of the boxes and let's give more room for writing something in, but not too much. Not too much.
So we're going to have a microphone come around. If anyone has questions, the microphone's going to be right back here. And I guess we can, sorry, the hand to go up here first. If you could, well, actually, you can. And if you could, just kind of keep the questions short.
Could you speak to the bail system, which I understand is a big problem for people who don't have money for bail? They end up staying in jail long enough to plead guilty and walk out, but then they have a record.
Sure. Bail reform is something that we talked a lot about in our movement and in my organization across the country, from federal, from state, from local perspectives. And you just highlighted exactly what's happening. People are coming in to, at the front end and being, accused of a crime. And the question should be, are there conditions or combinations of conditions that can ensure the safety of the community and the person coming back to court? And detention, locking somebody up while they're presumed innocent before anything has happened, should be the last resort. Instead, it is often the first. And often, people aren't even asking, there's not a requirement in a jurisdiction to ask those two questions. So we have to completely reimagine that system right there of bail, and certainly should not ever be tied to one's ability to pay. And part of that needs to be, we need to have ability to pay assessments. So even if someone's working, you want to say, well, what are your bills? Who are you supporting? What is your debt load? To make a real determination of if money bail is ever even appropriate. The thing about bail is that the other thing that happens on the other end with a parole or violation is that bail, often if a person is arrested on a new crime and they come and they're on probation or parole, you may get bail because there is so much of a highlight now on bail reform. They might say, okay, so you're on probation or parole. Okay, so you're alleged to have committed this crime. We're not going to have bail. We're going to let you go. But because you're on probation or parole, there's what's called a detainer that scoops people up, even if they were granted bail, and holds them without a hearing. So you're getting it from both ends. We've got to reimagine this entire system from the beginning to the end.
Take one more.
Hi, thank you. I have two questions, but one is real quick. I just am confused that you seem to be using parole and probation interchangeably, and I'm just wondering what the difference is between them, or if they are in fact the same. And the second one is about how large of an obstacle is the vested interest in maintaining the current system with the private prisons and the economy that is created around these broken systems. How much are they problematic in trying to fix this issue? Thank you.
So I'll take on the first one. What we're hitting on is the way community supervision is happening in our communities overall. Probation is often in lieu of incarceration, and parole is often when you spent time and you're getting out early, right? And how you're being supervised. So oftentimes, especially in California, the same people are supervising both people on probation and people on parole. But it's the practice of supervision that we're calling into question and wanting to change.
And if you wanted to quickly take the...
Yeah, I mean, I think, and Yasmin hit on this earlier. I mean, I think, and as someone who's worked in government, someone who believes in the power of government, government does often try, and institutions generally, right, try to sustain themselves. And I think, if we are able to reimagine community supervision as a system that's more aligned towards, being a service brokerage, gearing people towards, and not just a checkbox, right, to the right program, I think it calls into question right? Whether this is in fact, these are the right departments to do that. Are there social service agencies? Are there nonprofits who could do a better job? And so, there very well may be an uphill battle to create a political project that can entirely abolish this system. So, the question is sort of what is its right place? But I think in the meantime, sort of to your question, largely accurate, there's a large chance that these systems just try to continue, right, to widen their net. They try to sustain themselves.
Of course, we could talk about this all day, but Yasmin, Robert, Sam, thank you so much for joining us, and thank you all for being with us.